Actually, it was astonishing. It was really a very nice experience, and we had to face some problems, of course, because this is something new what we try to develop. But I was really surprised in a positive manner, in a positive way, with the result of the precision. Because with this type of patients, with the dentalist patients, the always problem is how to rigidly place the guide, which will not change the position after delivery of the anesthetics, after a little bit swelling of the soft tissue. So by using these temporary implants as a support on the bone is really a great idea, I think. For sure, it was great to communicate to the rest of the group, to the rest of the team, that they have to be focused, to very precisely prepare and check the guides, and as well, what is very important in my opinion, to have the good knowledge about the protocol. So every one of them will get in advance or got already some PDF files which we created based on the planning in the co-diagnostic software. So they know exactly what kind of instruments they will use, what kind of implant will be placed, and as well exactly the size of the abutment. So this is good. I love the co-diagnostics and the software because what I realized that inside of the library of the components you have not only implants but also you have this abutments line. So you can select after planning the positions of implant if you have additional information like STL file from the denture size, the denture in general, you can exactly select the proper abutments, including the angulation and the position. And at the end, what is great, that the software gives you the list of all the components. I don't have to give it to my assistant to try to find which is correct. No mistakes. So this is good. This is not only the benefit for the patient, this is also the benefit for whole my team, because immediately we have much more control about the line of the products we should have during the surgery. And of course, for the patient, the huge benefit is to limit the time which patient has to spend on the dental chair. So I think, of course, everyone will benefit, but I see the benefits not only for the patients. I see the benefits from the point of view how we manage our team and how we manage orders and all of these things.
Today the surgery was quite nice because we had a good patient and the bone situation was good, so that we could place the all 6 implants through the guide, and the prosthesis in the end fit really very, very good. So I assume that it is a very precise tools that you have. Today we had a nice case. I was very much impressed that the patient could stay 3 hours long until we finished everything from A to Z. Chris is of course a very experienced surgeon. It was for me a pleasure to work with him together. As you know, I assist him today. But also my experience in the guided surgery over the years that I had with also other systems helped us too much. But the result was very good in the end. What we saw, very precise fitting denture.
So we're basically part of a study. We are operating patients and with the whole purpose of developing a workflow, a digital workflow from beginning to end. We have several clinics involved. We are in center number 3, and literally what we just did today was we operated 2 patients with 10 implants and with immediate provisionalization straight away, which is brilliant and is absolutely great. We can say that from the moment where we started, the project is really ambitious, and we really want to go in the smoothest way and at the same time to have great results as we are having. The patient got on really well. Why? Because first of all, it was quicker than normal. Secondly, we didn't need to do such an invasive procedure as we would have to be in order if we didn't know what was underneath and if we hadn't planned it this way. So the patient actually loved it, and as we could see, the patients were all smiling at the end of the day, which is brilliant. Basically, in order to do these in a predictable fashion, we need to plan a lot in advance, because otherwise things go out of the predictability. So we have to use software, real software, for planning. In this case, we use co-diagnostics. And the co-diagnostics, we literally assemble a lot of data from CBCT scans, from scans of models, a lot of different gadgets. And we assemble all that information. We study the case of each patient in order to make this happen. Because when we were starting the operation, we really knew how this operation will end. Why? Because everything was planned in advance, because of that predictability and that reproducibility. Before the patient came, the dentist did some models, did some study models, did a CBCT scan in order to evaluate the bone levels. And at the same time, 3 provisional implants were placed. Why they were placed? Because we needed retention for a surgical stent that was placed in the mouth to guide the full workflow. And this was literally what was the big success of the whole procedure, because we managed to have literally something that it was guided into the right position without having any sort of bad outcomes. It was literally ended the same way as it was predicted in the beginning. Straumann is aware that there's a missing link in between the development and literally the mainstream clinicians. And instead of just research, taking the research to the universities, probably bring these back into people that do these much more often than actually universities do, and at the same time to make accessible clinical research or inline case series, which is what this is all about, to main key opinion leaders, in this case in Poland. So the whole thing is to bring a new workflow into the market, to bring something new, something attractive, something predictable, something reliable, and something that most of all is reproducible for every single participant. And this is the main goal, is actually to bring this sort of research, this inline case series, in a way that has never been done before. And I think we're quite unique so far in what we're doing. Well, when we're talking about formation and education, everybody does it, but nobody takes it this serious as we do. And the reason for that is, no company in the moment in the world has ever done what we did here so far, which is an inline case series for a big study. And these big studies literally going to be published in peer magazines. So this is not just formation and education and to come into some marketing tools. This is the real thing.
In this clinic today, and in parallel in 3 other clinics in Warsaw, an inline case series is ongoing. The topic of this inline case series is, for the first time in the world, to test the BLT guided implant bed preparation in full arch restorations. The patient has been previously investigated. All his medical files are coming with him, so general health, but also local conditions. And the patient got 3 weeks ago, 3 temporary implants, which serve us as markers to orient the CBCT, to prepare the provisional prosthesis. And now the patients will benefit of implantation of BLT implants. So for the first time in the world, BLT guided implant bed preparation for his full arch reconstruction. And he will leave the clinic after a couple hours of work with a screw-retained provisional prosthesis. For the patient is less traumatic. We try to avoid to open flaps, and is leaving the clinic with a smile. This will be daily practice. Currently, with the Poland team, and it's an objective here, it's to set up standards and to set up a workflow which will be as easy as possible, as efficient as possible, but every practice can use it in the near future with a BLT implant, with guided surgery. There are still some gaps. We have fantastic technology at Straumann based on co-diagnostic, based on BLT implant with surface, but the advantage of doing this inline case series is that we identified the gaps and we were able to overcome this gap. So that means this will be an important outcome of the week here, but we will have definitively improved the workflow at the end of the week.